Hi everyone, my name's Taylor. The disorder that I chose to do a presentation over is seizure disorder, also known as epilepsy. So, what are seizures? Seizures are abrupt, abnormal, excessive, and uncontrolled electrical discharges of neurons within the brain, causing altered mental status, changes in motor and sensory ability, and or behavior sometimes. So, when an individual has a seizure disorder, basically it's a chronic neurological condition characterized by recurrent seizures. Typically, you have to have two or more. And then the symptoms vary depending on the area of the brain that's involved. So, there's quite a bit of risk factors for seizures. They include genetic predisposition, acute febrile state, which is children less than 2 years old. If you have any head trauma or brain tumor, cerebral edema, which is the fluid up here. If you abruptly stop your seizure medications, also known as the anti-epileptic drugs. If you've had a stroke, if you're exposed to toxins, hypoxia, so low oxygen perfusion to your brain, if you have acute substance withdrawal from drugs, and then as well as fluid and electrolyte imbalances. So there's 5 different seizures that you can have. One of the most common is a generalized seizure. It involves both cerebral hemispheres. It can begin with an aura, which is an alteration in vision, smell, hearing, or emotional feeling. Then you have your tonic-clonic seizure, which is 2 different phases of one seizure. They begin only for a few seconds with the tonic episode, which is stiffening of the muscles, and also that's when you go into your loss of consciousness. The 1 to 2 minute clonic episode, which is the jerking of your extremities, is the phase that follows the tonic episode. Common things to look for: breathing can stop or become regular. Biting of the cheeks or tongue can occur, and then incontinence as well can accompany the seizure. For people with epilepsy, it's very important for them to determine what their trigger may be. So there's quite a bit of these as well. It can be increased physical activity, excessive stress, hyperventilation, being very, very, very fatigued. If you have an acute alcohol ingestion, it is advised, especially on the medication, to not take or do not drink alcohol with those medications. Excessive caffeine intake, exposure to flashing lights, and then substances such as cocaine, aerosols, and inhaled glue products. So some expected findings of an individual who has had a seizure. Number 1, they're going to lose their consciousness. So just be considerate of their surroundings and what's in the area, because there's already going to be a lot of twitching, a lot of muscle rigidity and all that. So possibly set them up in the safest environment as possible. Typically, someone who has that onset of the seizure will have a staring spell. They'll kind of just look like they're staring into space. The postictal confusion comes after the seizure. So just a lot of confusion, agitation. There might be a little bit of sadness. I've seen that behavior as well. And then their body is just really, really, really fatigued. Diagnostics for your seizures is going to include an EEG, a CT, and an MRI. The EEG is going to measure the electrical brain activity, and it can identify the origin of the seizure activity. The CT and the MRI is going to identify more structural abnormalities, or maybe like a mass or a tumor or something that's pressing on the brain structure. Very important safety considerations, because these patients are losing their consciousness. So padded side rails, so when they're twitching, and their muscles are really tense and tight, they're not injuring themselves. Keeping the bed in the lowest position, because again, they're going to lose consciousness. That onset of a seizure, sometimes if you don't catch it right away, they could fall and they could injure themselves further. Keeping suction and oxygen available. Patients that tend to have seizures have a lot of drooling and oral secretions. Do not restrain your patients during seizures. Be sure to turn them on their side to prevent aspiration, and then assist with pillows or padding. And then you always want to maintain the airway. Do not put anything in the mouth, and do not attempt to open the jaw. A couple other things to do when a patient's having a seizure: loosen tight and restrictive clothing. And then also you want to document the onset of the seizure and the duration of it. And you want to try to determine what that trigger was for this patient, so we can try to avoid that in the future. So after a seizure, this is called the postictal phase. You want to maintain that client on their side position to continue to prevent that aspiration, and then to continue to get rid of the drainage of the oral secretions. Check the vital signs, because they might tend to be low on oxygen, and then assess for injury, especially if they fell, if they didn't have any protective padding near them. Like I said, try to determine the possible trigger, and then allow the client to rest. They're going to be extremely fatigued. Keep them calm. They might be agitated. They're going to be confused. They don't have that oxygen perfusion to the brain. Some therapeutic procedures or options, of course, is your medication therapy. These patients are on very, very strict adherence to the medication, take it at the same time every day, sometimes 1 to 3 times daily. We have our vagus nerve stimulator. It's an implanted device that sends electrical impulses to the vagus nerve. And then we have a responsive neurostimulation device. It's another implant, and it delivers targeted stimulants to stop a seizure before the symptoms actually occur. Treatments and medications. The drugs are going to include the anticonvulsants, and then we have our lorazepam, which may be used during active seizures. So what you would want to tell your patient and educate them on is really, really, really adhering to the medications and taking them consistently every day. Sometimes it takes a little bit of time to get to that therapeutic effect. And also, each medication is different, and it's going to work with every patient different. So it might take some trial and error to figure out which medication is correct for that patient. Avoid alcohol and recreation drugs. Get adequate amounts of sleep. And then, of course, avoid driving unless instructed to do so, because these patients, obviously, they lose consciousness. So some complications is we have status epilepticus, which is a repeated seizure activity without full recovery within a 30-minute time frame. We have aspiration, of course. That's why we lay them on the side. Injury. That's why I'm, big on the safety and the pillows, the padded rails, stuff like that. Hypoxia, not enough oxygen perfusion, and then the sudden unexpected death and epilepsy. Okay, you guys, that concludes my presentation. I hope you enjoyed, and I hope I was able to give you some clear insight and knowledge on what seizures are and what causes them, and just a little bit of knowledge about what you should do if you were ever to be in that situation with a patient. Guys, have a good night.